And today we're going to talk about fluid volume excess. Again, this is another one of those basic fundamental concepts that individuals tend to forget when they get to some of their core classes, such as the med surg or some of those other classes that may have diseases that deal with fluid volume excess, right? So let's get started here. So when we talk about some of our risks for fluid volume excess, drinking too much water. Now, obviously that doesn't occur very often, but is it possible? Yes, it is possible for individuals to take in too much water, especially when you're sick or ill. If you're taking in a lot of fluids and not putting out putting out adequate amount of fluids, so you're retaining those fluids, then you could potentially cause yourself to go into fluid volume excess or fluid volume overload. If you're receiving IV fluids too quickly, that can cause a patient to go into fluid volume overload. So you want to monitor. There are certain situations I know where your IV fluids do need to go in rather quickly, but you need to make sure you're monitoring your patients and ensuring that they're not going into fluid volume overload or having fluid volume excess, because when you are administering those fluids quickly, that can happen. Giving tap water enemas is another reason someone could have fluid volume excess. And drinking more fluids than you excrete. So remember, we said there's a lot of ways. When we talked about fluid volume deficit, we said there was a lot of ways you take in and release fluid. So anything you put in the body, your water, whatever you drink, foods that you eat, such as your fruits, things that you can take in, like your IV fluids, your parental nutrition, if you have a PEG tube, or any of those things are intake. And things that cause fluid, you to release fluid, maybe your urine is considered output. If you have diarrhea, that's considered output. Vomiting is output. Wound drainages is output. Anything that comes out of the body. So don't get the two mixed up. It's very simple. Things that go in the body is considered input. Things that come out of the body, fluids that come out of the body, that's considered output. Right? So what are some signs and symptoms? So fluid volume excess, we're obviously retaining fluid. So we're not putting out enough fluids. So typically, as a rule of thumb, whatever we're putting in, we should be putting that amount out plus another 500 as a rule of thumb typically. So signs and symptoms of fluid volume excess. You have increase in weight. So if you're retaining that fluid, your weight is going to increase as well. Crackles in the lungs. That's another sign. If you have fluid in the lungs, you're probably going to hear crackles in the lungs. Slow bounding pulse. And remember we said, when we talked about fluid volume deficit, remember we said that the blood pressure is going to follow the fluid volume in the body. So in this case, with fluid volume excess, the volume of fluid in the body is increasing, which is going to cause our blood pressure to increase as well. So remember, the blood pressure is going to follow the fluid volume in the body. So the fluid volume is increasing, our blood pressure is going to increase. They could possibly have edema, especially when you think about certain conditions or diseases that cause you to retain fluid. For example, glomerulonephritis, congestive heart failure, syndrome of inappropriate antidiuretic hormone. Remember, I said when you get to your med surg classes or some of those other classes, fluid volume excess is fluid volume excess. So don't get hung up on you're talking about a particular disease. If you're talking about fluid volume excess, you're still going to see some of these same signs and symptoms. And so edema is a possibility when you have fluid volume excess, no matter what you might be talking about. Lethargy, if you have a lot of fluid volume excess, think about if you've got fluid volume excess, fluid buildup in the brain, right? It can cause you to be lethargic. Distended neck veins. So remember, we said with dehydration they were going to be flat, but now we're talking about fluid volume excess. So you may have distended neck veins. That could be an indication of fluid volume excess. So if you notice these signs and symptoms in your patient, then we need to be putting some things in place to try to help relieve your patient. So nursing interventions and treatments for a patient with fluid volume excess. Obviously, we're going to monitor their intake and output. And again, if you have a patient, say, that's incontinent or something like that, and they need to be on strict INOs, then maybe you need to consider a Foley catheter or something, so that you can monitor those INOs. Daily weights, because their weight is going to be increasing. And so we need to monitor those weights to ensure their weight is not continuing to increase. So remember, we said when you monitor daily weights, you want to do it in the morning, same time in the morning, before they eat, after they urinate, same amount of clothes, same scale if possible, so that you can get an accurate weight for these individuals to determine, are they continuing to retain fluid or is it improving? Diuretics may be something we want to do for these patients to help get rid of some of that fluid. They may restrict the sodium intake. Remember, water follows sodium. So if you continue to increase your fluid intake, if you can continue to increase your sodium intake, you're going to increase water in your body. So you need to be able to educate your patients on low sodium items. So low sodium items, or high sodium items, I should say. Anything that's processed. So something I could just possibly put in the microwave and go. That would be considered high sodium. Your lunch meats are going to be high sodium. Canned foods are going to be high in sodium. Your fresh fruits and vegetables are always going to be better than, say, your canned vegetables. Even frozen, fresh is better, but frozen is even better than the canned items, because those canned items are going to be really high in sodium. So you need to be able to educate your patient properly on what's considered low sodium, what are low sodium foods, and how they prepare their foods. Educate them to read the labels as well. They may need a fluid restriction, because I don't want to keep putting excess fluid in their bodies and they're continuing to retain that fluid. So they may need to be on a fluid restriction as well. And then treating the underlying cause, obviously, right? Because if the issue is congestive heart failure, I need to treat the congestive heart failure to stop the fluid volume retention. If the issue is glomerulonephritis, I need to treat the glomerulonephritis to stop the fluid volume retention. So we want to treat that underlying cause as well, right? So these are your risks, your signs and symptoms, and possible nursing interventions and treatments for your individuals that are in fluid volume excess. So if you like this video and you'd like to see more videos like this, then consider subscribing to my YouTube channel, Creating Future Nurses. Thank you for watching. Have a great day.